Hello, everyone, and welcome to Question Lab. We're happy to have you here this evening as we dissect the questions on the topic of virology. Leading our discussion once again today is Dr. Paris Vicaria. He's going to introduce himself now. Paris.
Thank you, Sean. Hey guys, my name is Paris. I am a dermatology resident here in Dallas, Texas. I originally graduated from pharmacy school and then went back home to Michigan to do medical school. I'm also an RX coach with USMLE-Rx. So I work one-on-one with students such as you guys to help prepare you guys for the USMLE Step 1 and Step 2 CK as well. And I'm happy to help lead tonight's session.
We spoke about RX Coach earlier. We'll talk about it later. What I want you to know right now is that RX Coach is our tutoring and coaching program where we work with students one-on-one. The methodology that we will employ this evening as we dissect these 4 questions is similar to the methodology that we employ in our coaching sessions. So without any further ado, let's go ahead and get into our first question on the topic of virology. Now you will see here that the answer choices have been removed. That is by design. We do that because we don't want you to be jaded by these answer choices. We don't want you to be guided by them. We don't want you to see an answer choice that you're unfamiliar with, which may cause you to panic or dictate your thought process. So we've gone ahead and removed those. After we remove those, we go ahead and begin with the lead-in. The lead-in is the last sentence or the question itself. And we do that because we want you to know what the test writer is asking before you read that vignette, so you can pick up on all those relevant clues and not have to reread that question. So let's go ahead and read that lead-in now. Which of the following viruses has the same viral polymerase as this patient's most likely infecting virus? Which of the following viruses has the same viral polymerase as this patient's most likely infecting virus? Once we read the lead-in, we'd like to ask our students how many steps they believe this question will require. An example of a 1-step question could be where you ask for the diagnosis. An example of a 2-step question could be where you ask for the treatment for a diagnosis. And an example of a 3-step question could be where you ask for the mechanism of action for a treatment for a diagnosis. So I'll give all of you a few seconds here to respond in the question box and let us know how many steps you believe this question will require. And of course, you can ask questions in the question box, and our panelists will do their very best to try to answer them for you. I see the responses coming in, so let's go ahead and take a look at that vignette. A 50-year-old woman presents to the clinic with complaints of a dry cough and fatigue for 5 days and the development of a fever on day 6. She now cannot taste or smell her food. The patient recently traveled for the holidays to visit family without a mask or quarantining during a known pandemic. Which of the following viruses has the same viral polymerase as this patient's most likely infecting virus? Paris.
Thank you, Sean. So what we're going to do is we're going to go ahead and show you what we think are the important clues in this vignette and the lead-in. And so starting off, generally most questions will start off with demographics. And in this case, we kind of have that same thing here. We're told about a 50-year-old woman, and then they'll usually tell you, why are they coming to the hospital? Why are they coming to see the doctor? And in this case, it's because of a dry cough and fatigue as well as a fever, okay? Sometimes they'll also give you a little bit of time frame. Has this been going on for a few days, a few months? So you can get a sense of the chronicity. And they kind of told us a little bit about that in this question. They are now giving us some other important signs and symptoms and some other social history. And then they're asking us specifically about a virus that is most likely the most likely infecting virus in this patient. But they're not just asking that, they're asking about another virus that has the same viral polymerase as that virus. So I think we've got a few steps here. I think one, we've got to figure out what virus is the most likely infecting virus in this situation. And then 2, what is the viral polymerase of that infecting virus? And then 3, what other viruses have that same viral polymerase? Okay? So I think we have a nice 3-step question here. So let's go ahead and let's take a look at those answer choices. And what you see here are 5 answer choices. And usually when we work with students, we recommend that students actually, as they go through these, that they start at the bottom of the answer choices and they work their way up to the top. And the reason we do this is because a lot of times we'll see students who they'll start at the top, they'll see something they like, and they'll select it without having gone through all the answer choices. As a result, sometimes they'll get that question wrong. So we recommend doing it this way to prevent yourself from biasing yourself and prevent yourself from making that mistake. So let's go ahead and let's do that now. Answer choice E, molluscum contagiosum virus. D, herpes simplex virus 1. C, hepatitis C virus. B, hepatitis B virus. And A, adenovirus. So we're going to go ahead and open up that poll. Go ahead and select the answer choice you think is the best answer here, and we'll talk about it in just a few seconds.
Well, thank you, Paros. The poll is open. Remember that there are no penalties for guessing on the test. You should never leave a question blank, and certainly not tonight. So if you're unsure, don't worry, take your best guess, and then as always, Paros will walk you through the correct and incorrect answer explanations. Once again, we'll wait until about 2/3 of you have responded, and all of your answer submissions are completely anonymous. See the responses coming in. We'll give all of you a few more moments. All right. Well, let's take a look and see what all of you selected. Looks like 50% of you selected adenovirus and 36% of you selected hepatitis C virus. So let's take a look and see what the correct answer is. And the correct answer is C, hepatitis C virus. And with that, I'm going to hand it off to Paros.
Thank you, Sean. Yes, great job, guys. Definitely a nice, tough virology question to start off with. So let's take a look at what's going on. Hopefully, you guys picked up that this patient might be having SARS-CoV-2, severe acute respiratory syndrome coronavirus 2. This patient has a fever, dry cough, and fatigue. They've also lost their taste of smell, their sense of taste and sense of smell, okay? We also know that they were traveling recently without a mask or quarantining during a known pandemic. Pretty consistent with what's going on right now, okay? Now, this virus is a positive sense RNA virus. On the next slide, we actually have a little bit of more information on these RNA viruses. So you can see here that one of these coronaviruses, COVID-19 and SARS viruses, are listed there. These are positive sense RNA viruses, okay? Therefore, it has an RNA-dependent RNA polymerase, okay? And actually, some of the tests used to detect this actually utilize this function. Now, other viruses that also could use that same viral polymerase, you can see there that our flaviviruses, which includes hepatitis C virus, is also a positive RNA, positive sense RNA virus. So this also uses an RNA-dependent RNA polymerase, which is the same as the SARS and COVID viruses of the coronaviruses, okay? So thus, the best answer choice here is hepatitis C. Now, if we look at the other answer choices, molluscum contagiosum, that's in the pox family, and that is a DNA virus. So that actually uses DNA-dependent polymerases, okay? Herpes simplex virus 1, or HSV1, this is in the herpes family, and this is also a DNA virus. So this also uses DNA-dependent polymerases. Hepatitis B is also a DNA virus, and that uses an RNA-dependent DNA polymerase, okay? And then lastly, adenovirus. This is also a DNA virus that uses a DNA-dependent polymerase. So the other four answer choices do not use the same polymerase as our infecting virus.
Well, thank you very much, Boris. Challenging question indeed. So let's go ahead and move on now to our second question of the evening. Once again, the answer choices have been removed. That is by design. And as always, we will begin with the lead-in. Which of the following viruses is most likely responsible for this patient's symptoms? Which of the following viruses is most likely responsible for this patient's symptoms? I'll give all of you a few moments here to respond in the question box and let us know how many steps you believe this question will require, and then we'll begin with that vignette. All right, I see some responses coming in. Let's take a look at that vignette. A 36-year-old man presents to the clinic with 2 weeks of worsening fatigue and skin rash. Physical examination reveals a nodular rash affecting the scalp, axilla, and groin. There is diffuse lymphadenopathy. The serum calcium is elevated. The complete blood cell count shows a white blood cell count of 120,000 cells and lymphocytes with condensed chromatin and large multi-lobed nuclei. He is found to be infected with a virus that can also cause a demyelinating disorder. Which of the following viruses is most likely responsible for this patient's symptoms? Boris.
Thank you, Sean. So let's go ahead and take a look at this question now. We have a younger patient now, a 36-year-old male, okay? And he's coming in because of fatigue that's worsening and a skin rash. So those are the presenting signs and symptoms that you want to make note of. They also give us a little bit of information about chronicity. This has been going on for 2 weeks, okay? Now the physical exam findings do show a description of a rash as well as the location of the rash. Always important to note not just the description of the rash, but where is it involving the body, okay? We get some more physical exam findings, some lab findings, and then they tell us that he's actually infected with the virus. And they give us some clues about that virus. So you want to use those clues to help come up with the right answer. And then they ask us about the virus most likely responsible for the patient's symptoms. So I think we've got a nice 2-step question here. I think 1, we've got to figure out exactly what's going on with this patient. What's the condition, what's the diagnosis, and then 2, what virus is responsible for that. So I think we've got a nice 2-step question here. So let's go ahead and let's take a look at those answer choices. And once again, we're going to start at the bottom and we're going to work our way up to the top. Answer choice E, JC virus. D, human papillomavirus. C, human herpes virus 8. B, human T-cell lymphotropic virus 1. And A, hepatitis B virus. So we're going to go ahead and open up that poll. Go ahead and select the answer choice you think is the best answer here, and we'll talk about it in just a few seconds.
Well, thank you very much, Boris. The poll is open. Once again, we'll wait until 2/3 of you have responded. Keep in mind that we do have a raffle at the end. You must be present to win, so stick around. Tonight might be your lucky night. We also have a special offer for all of you in attendance. See the responses coming in. There seems to be a clear favorite so far, but we'll give all of you a few more moments here. About half of you responded so far. We'll give all of you a few more seconds here. All right, let's take a look and see what you selected. In first place with 43% was human T-cell lymphotropic virus 1, and in second place with 32% was JC virus. In third place was human herpes virus 8. So let's take a look and see what the correct answer is. And the correct answer is B, human T-cell lymphotropic virus 1, and 43% of you got it right. A challenging question. Congratulations to those of you who got it right. But let's make sure we all got it right for the right reasons. Boris.
Thank you, Sean. Yes, great job with this question. Another tough question here. So let's take a look at what's going on. Well, as you can see, this patient presented with fatigue and a skin rash, okay? So we need to take a little bit of a look at what's going on. Now, they tell us that this patient's got an elevated white blood cell count. You can see that's pretty high, 120,000. And they say that the lymphocytes have a large multi-lobed nuclei, okay? On top of that, we know this patient has elevated calcium, okay? And that this virus can cause a demyelinating disorder, okay? If we take a look at the next slide, this is talking about adult T-cell lymphoma, and it's caused by HTLV, okay? And adults present with cutaneous lesions. Our patient also had lesions, nodular skin lesions, okay? You can see they're also with bone lesions and hypercalcemia, okay? Now this, this same virus can also cause HTLV1 associated myelopathy, okay? So it can also cause demyelination, okay? Now that multi-lobed nuclei that they're talking about is often that flower cell lymphocytes that we talk about, okay? So if we take a look at the question again, hopefully you can see now why this is the best answer choice here. We've got an elevated calcium, we've got those flower cell multi-lobe nuclei, we've got nodular rash. This virus can also cause a demyelinating disorder. Now let's take a look at the other answer choices. I know a lot of people selected answer choice E. Now the JC virus is associated with something else. That's associated with progressive multifocal leukoencephalopathy, or PMLE. That is a demyelinating disease that develops in immunocompromised patients, okay? They may have neurologic issues, but their skin, blood findings would not be consistent with what this patient has. Human papillomavirus, this causes warts and other types of cancer as well that can result, like cervical cancer, not what we have going on here. Human herpes virus 8, that's associated with Kaposi sarcoma, which you see often in the setting of HIV. And answer choice A, hepatitis B virus. This is associated with hepatocellular cancer and other issues as well, such as hepatitis. Not what we're really being described here. So the best answer choice here, like you guys selected, is answer choice B.
Well, thank you very much, Boris. Great job, everyone. Challenging question indeed. You know, if you're finding a lot of these topics challenging and you want some help, you know, we're here for that. RX Coach is here for that. RX Coach, like I said, is our tutoring and coaching program. If you're studying for your boards or a comprehensive shelf exam, we'll start you off, or a comprehensive exam rather, we will start you off with our 160 question assessment, and then we will base a personalized study plan for you on that assessment. We'll work with you one-on-one to help you create a study schedule, work with you to implement it, work with you to identify and bridge your knowledge gaps, make sure that you have a foundation that is strong with content, but also that you can apply that content and have mastered your test-taking skills. If you're in medical school studying for block exams or subject-based exams, we'll look at your syllabus and your learning objectives and base your study schedule on that. Now, although we provide you with all of our resources, and keep in mind that we are one of the only tutoring and coaching companies that was in medical education prior to getting into tutoring and coaching, and we've authored our own resources, right? We've got bricks, we've got the digital first aid, we've got QMax, our question bank, we've got FlashFacts, our flashcards, we've got Express Video, we've got all these resources we'll give you. But in your study schedule, don't worry, we will incorporate other resources that you would like to use. All right, so if you're interested in working with one of our coaches, please reach out to us at rx-coach or rx-coach.com. If you want to talk about the program and how it can benefit you, you can click on the free consultation tab to discuss the program. We're more than happy to talk to you about it and see if it is a good fit for you. Once again, that's rx-coach.com. If you look at our student satisfaction, it's extremely high. We've had a lot of great success stories. This week alone, we had 3 of our students score well above the mean, and we'd love to make you one of our success stories as well. We work with students who graduated 10, 15, 20 years ago and help them find success as well, and I'm sure we can help you as well. So once again, that website is rx-coach.com. With that being said, keep in mind that we do have a raffle and a special offer at the end. You must be present to win. Let's get into our third question on virology. Once again, the answer choices are covered up. That is by design. Let's begin with the lead-in. The pathogen causing this patient's most likely diagnosis can also cause which of the following diseases? The pathogen causing this patient's most likely diagnosis can also cause which of the following diseases? I'll give all of you a few moments here to let us know in the question box how many steps you believe this question will require. Then we'll move on to that vignette. Give all of you a few more seconds here. All right, let's read that vignette. A 12-year-old girl is brought to the emergency department by her mother because of memory difficulties and bizarre behavior over the past 2 days. The patient has received all scheduled childhood immunizations. Cerebrospinal fluid analysis shows white blood cells of 90, neutrophils 20%, lymphocytes 80%, RBCs of 435, protein of 100, glucose of 50. MRI of the brain is shown. I'll give all of you a few moments here to take a look at that image. The pathogen causing this patient's most likely diagnosis can also cause which of the following diseases? Boris.
Thank you, Sean. So we're going to go ahead and show you now what we think are the important clues in this vignette and the lead-in. And so starting off, now we have a much younger patient, a pediatric case, a 12-year-old girl. And she is brought in because of memory difficulties and bizarre behavior. They also tell us about how long it's been going on. So 2 days, okay? We're given some information about immunizations and then some CSF fluid, okay? So you definitely want to take note of that and use that to analyze what you think might be going on. And then we also see a nice MRI of the brain. So this question is then asking us about a few steps, I think. I think one, we've got to come up with the most likely diagnosis. You can see we've highlighted that. 2, what is the pathogen in that most likely diagnosis? And then 3, what other diseases are caused by that pathogen? So I think we have a nice 3-step question here. Let's go ahead and let's take a look at those answer choices. And once again, you can see, first of all, we'll give you guys a nice little close-up here of that MRI of the brain. And then we'll take a look at the next slide, and we'll take a look at the answer choices. And here, once again, we will start at the bottom, and we will work our way up to the top. Answer choice E, otitis media. D, gingivostomatitis. C, epiglottitis. B, dilated cardiomyopathy. And A, chorioretinitis. So we're going to go ahead and open up that poll. Go ahead and select the answer choice you think is the best answer here. And we'll talk about it in just a few seconds.
Well, thank you, Boris. The poll once again is open. Our third question of the evening. Let's try to finish strong. I see there's kind of a favorite so far, but not so clear yet. Seems kind of close. About 1/3 of you have responded. We'll give you some more time. Half of you have responded. We'll give all of you a few more moments here. All right. Let's take a look and see what you guys selected. Well, it was close. In first place with 34%, we had chorioretinitis, and 29% of you selected gingivostomatitis. So let's take a look and see what the correct answer is. And the correct answer is indeed D, gingivostomatitis. And 29% of you got it right. So definitely a challenging question. Let me hand it off to Paul so you can help us all be masters of this topic.
Thank you, Sean. Yes, definitely a tough question here. So let's take a look at what's going on. Now we've got a guy, we actually have a 12-year-old girl who has some memory issues and behavior issues, okay? And that CSF profile shows elevated white blood cell counts that are predominantly lymphocytes, okay? On top of that, we have a little slightly elevated protein, okay? And RBCs as well, so suggesting a viral infection, okay? Now, as you can see there, the MRI, those blue arrows are showing what we call a little bit of increased attenuation. And those are the temporal lobes, okay? So this patient most likely has encephalitis that is affecting the temporal lobes, which we know can be a complication of HSV-1 or herpes simplex, okay? Let's take a look at the next slide, and here you could see the HSV-1 and the herpes virus table. And you can see there that this can cause, in clinical significance, number one, gingivostomatitis, which is when you get inflammation and ulcers of your gingiva, of your mouth, okay? That's called gingivostomatitis. That's different than when you get cold sores on the lips. Labialis meaning lips. So herpes labialis is when you get cold sores on the lips. But when you get ulcers and sores inside the mouth, on the gingiva, and deeper in the mouth, that's called gingivostomatitis. And you can see that with the herpes virus. You can also see later on, it talks about how this can cause temporal lobe encephalitis, which is probably what this 12-year-old girl had, okay? So if we take a look back at our question now, hopefully you guys can see my answer choice D is the best answer. The most likely diagnosis here is encephalopathy, likely due to a pathogen of herpes simplex, HSV-1 specifically. And then that can also cause gingivostomatitis. Now the other answer choices, in case you selected that, otitis media, that could be caused by strep pneumo or strep pneumoniae, but that would show signs of a bacterial meningitis, so more neutrophils, low glucose on the CSF. Epiglottitis can arise in those who are unvaccinated due to an infection with Haemophilus influenzae, okay, but again would show similar bacterial findings of CSF analysis. Dilated cardiomyopathy can be caused by a variety of viruses, including Coxsackie-virus, okay? Now those can cause viral meningitis as well, but it wouldn't necessarily cause encephalitis, and it wouldn't be indicative of this patient who is also having the behavior and memory difficulties as well, which is more consistent with an encephalitis. Lastly, answer choice A, chorioretinitis, that can be caused by Toxoplasma gondii. Those who are immunocompromised are at risk for this. And that we would see different findings. We would see more ring-enhancing lesions in the brain on MRI. So a little bit of a different presentation. So tough question here on this one. Hopefully you guys can see how they like to ask these nice three-step questions and also throw some clinical images in there as well.
Excellent. Another challenging question for sure. Great job, everyone. Hopefully you learned from that wonderful explanation. Let's try to finish strong now with our last question of the evening. Next week's topic, by the way, is cardiology. We hope to see you then. And remember, we still have our raffle and our special offer at the end of our lab tonight. Tomorrow we have a question lab also. Tomorrow we have a webinar rather, Path to Success for the USMLE. I believe Jeff is going to drop a link in there for all of you to join us. We hope to see you then as well. Answer choices have been removed. Once again, we'll begin with that lead-in. Which of the following is an additional symptom of the patient's most likely diagnosis? Which of the following is an additional symptom of the patient's most likely diagnosis? I'll give all of you a few moments here to respond in the question box and let us know how many steps you believe this question will require. All right, see the responses coming in. Let's take a look at that vignette. A 37-year-old man comes to the clinic because of a rash on his face, lower legs, and genital region. He is HIV positive. Physical examination reveals multiple painless reddish papules, purple papules, and nodules in these anatomic regions. The patient says that he discontinued his antiretroviral therapy 6 months ago due to side effects. Which of the following is an additional symptom of this patient's most likely diagnosis? Paris.
Thank you, Sean. So now we're ending with our last question. So hopefully you guys are able to pick up on, what we think are those important clues in this vignettes and the lead-ins to really help you guys pick up the important information in those clues, not just in the vignette, but also the lead-in to really help get you to the right answer. Okay. So once again, we've got a 37-year-old male here, and he's got a rash. Okay. And again, it's important to take note of where the rash is. Okay. Not just where the rash is, but how do they describe it? In this case, they say multiple painless, reddish purple papules and nodules. Okay. We know a couple things about his medical history and his social history. Okay. And they're asking us about an additional symptom of the most likely diagnosis here. So I think we've got a nice two-step question here. I think one, we've got to come up with that most likely diagnosis. And then two, what is an additional symptom? So nice two-step question here. So let's go ahead and let's take a look at those answer choices. And once again, we've got 5 answer choices here. We're going to start at the bottom, work our way up to the top. Answer choice E, seizures. D, bradycardia. C, black stool. B, arthritis. And A, alopecia. So we're going to go ahead and open up that poll. Go ahead and select the answer choice you think is the best answer here. We'll talk about it in just a few seconds.
Excellent. The poll is open. We'll wait until about 2/3 of you have responded, and then it'll be time for our raffle. All right, about 1/4 of you have responded. We'll give all of you a few more moments here. All right, almost there. A few more seconds here. All right, let's take a look and see what you selected. Looks like there was a clear favorite here. 52% of you selected black stool. In distant second place was seizures, and in third place we had arthritis. So let's take a look and see what the correct answer is. And the correct answer is C, black stool, and 52% of you got it right. Our strongest showing of the night. Way to finish strong. Let me hand it off to Paris.
Thank you, Sean. Yes, great job, guys. Way to end strong. This is actually a nice, tough question here. So this patient, hopefully you guys picked up on that this patient who is HIV positive and who has stopped his medications may be having worsening HIV. And now has these violaceous nodules, which are consistent with Kaposi's sarcoma, or KS. Okay? And this usually is due to HHV8, or human herpes virus 8. Okay? This is an AIDS-defining illness. Okay? Now, these are vascular lesions. Okay? So these are, if you were to biopsy these would be very bloody. They would bleed a lot. Okay? Now, you can also have these lesions in your GI tract. Okay, so anytime you see a patient with Kaposi's sarcoma, you need to ask them about blood in their stool. Have they coughed up blood? And maybe even send them to your GI doctors to get them scoped via endoscopy and colonoscopy to see if they have lesions in their GI tract. Because if they do, those could bleed and then they could die from a hemorrhage. Okay? So these patients may develop a black stool, which indicates bleeding from a Kaposi sarcoma lesion that's in the GI tract. Okay. Now, if you selected some of the other answer choices, answer choice E, seizures, this would be not really suggestive of another symptom of Kaposi sarcoma. Okay. Answer choice D, bradycardia. Now, this could arise if a patient was on a medication, maybe, but not something that you would expect with Kaposi's sarcoma. Answer choice B, arthritis. Now, HIV patients can develop arthritis, but not necessarily because of Kaposi's sarcoma and HHV8. And then alopecia. Alopecia can result from a few things: a fungal infection, other infections, medications, but not necessarily Kaposi's sarcoma. So great job on this question as well. Way to end strong. And I will pass it over to you, Sean.